Taiwo Olabode Ladipo. I started work here as a part of the ministry, a civil servant. Started on the 1st of September 2004. I crossed in from the hospital's management board, where I used to work with babies. But something just sparked my interest in public health, and went for studies all the way to tertiary levels, and then yeah, I am in the Ministry of Health. I've worked in areas related to reproductive health, and one of the accomplishments I think I actually made was the area of malaria control. Having taken the state from perhaps one of the worst states in the southwest to the best performing state in terms of malaria control in the southwest of the country. Therefrom, I became the Director of Public Health. Everything that came out under my purview, and every headache was mine. And then next I knew was COVID came out of the blues, and I had to run the COVID response in the state. So I think I transited from being a core civil servant to becoming a quasi-politician. My role now is, yes, it's quite a demanding one, quite larger than what it was. It's tasking, but then it has its own times of smiles, times when you actually say that, okay, perhaps a thing or two that you've tried to put together come out fruitfully, and then it gives you the encouragement to go further. When I got into office, I realized that quite a lot is being done by the state government. I met a system that was a bit standalone, vertical. Health insurance was on its own. Primary healthcare system was standalone. We have colleges where manpower is being trained, standalone. Hospitals management board was doing secondary care facilities on their own. And my opinion and my view was to bring all of them together under one boat, under one roof, and try and see how they interconnect, so that we'll be able to have a system that can outlast us. And I think as we're going now, we're starting to see some evidence that yes, some of these things are coming together to form a system. All right, within the last year, we were able to complete the high dependency unit, a sort of a lower level to a critical care ICU, and it's there. It's about a 20-bed facility in State Hospital Ring Road. The renal dialysis unit is also completed. It has facilities to take care of 9 patients simultaneously. That facility can actually be competitive with any of the private facilities that are within the environment that we are. And it has the facilities to take in even patients from outside. The CT scan, the CT scanner is up and running, and the imagery section of State Hospital Ring Road that has digital X-ray mammography, CT scan is actually fully operational. So the last we have is a diabetic center that was just donated to the state by the Lions Club. And looking at that, the area of specialist services would be something that the state should be able to show to anyone all over the country and perhaps elsewhere that yes, a lot has been put in for healthcare services. I've worked with him on 2 different accounts. I've worked with him as the focal person for COVID, and I've worked with him as a commissioner. And I see in him something I wish I can emulate. Being attentive, very attentive. He can listen to you speak for 20 hours, he won't interject. He will not interrupt. And then when he wants to respond, he responds with clear things in mind. And that's something that I've seen from him even at the State Executive Council. It's something that I actually applaud and something I wish to emulate really well. He's a very kind-hearted person, looking at what his intents are, especially to the people that are in the public. It shows that he has basically the mindset of lifting people out of whatever seem to be challenges for them. And that's one rare attribute that one finds around these days.